Welcome to Medicine, Motherhood, and Missions, the podcast where real life meets big dreams. I'm Johanna, your host, and every episode will dive into inspiring stories from PAs, doctors, and professionals who are also dreamers and mission-driven changemakers. From the hospital halls to the hearts of our homes, and even into communities across the world, we'll laugh, learn, and uncover the challenges, triumphs, and everything in between as we see life through each other's perspectives. Looking for more joy and balance in your career? Don't miss our free guide, How to Be a Fulfilled Clinician, your quick boost of encouragement with tips to help you thrive while juggling all your hats you wear. And if you've got little dreamers at home, check out Little Evie's Big Dreams on Amazon. These stories are meant to spark imagination, courage, and kindness, perfect for bedtime or anytime. Follow along as Evie, a little Sri Lankan girl, brings joy and creativity to her community while daring to dream big. This podcast is also brought to you with love by the Ephraim Foundation International, because empowering children and families in rural Sri Lanka isn't just charity, it's continuing a legacy of hope and creating futures full of possibility. So grab your cup of coffee or tea, settle in, and get ready for uplifting conversations that will leave you inspired and equipped to make a greater impact. Let's jump in. Welcome back to Medicine, Motherhood, Missions, where we explore conversations that inspire purpose in medicine, family, and faith. Today's guest is Christina Davis, a physician assistant, founder of All Hands in Supporting Neurodiverse Development. Christina is a physician associate specializing in developmental and behavioral pediatrics with experience spanning primary care, pediatrics, behavioral health, school-based medicine, and community outreach. She's passionate about helping families navigate developmental concerns with compassion, education, and practical support, while also mentoring future healthcare professionals and expanding access to developmental services. Today, we're talking about developmental milestones, neurodiversity, early intervention, technology and healthcare, entrepreneurship, and how we can better support children and families. Whether you're a parent, healthcare provider, educator, or someone wondering how to recognize developmental concerns earlier, this conversation is filled with encouragement and practical wisdom. Let's jump in. Thank you so much, Christina, for being on the podcast. I'm so excited that you're here, and it's just amazing PAs out there, just the amazing things they're doing. And I'm so glad that we have this platform to showcase that and share the wonderful things and so many other PAs are doing. So thank you so much, Christina.
Thank you for having me.
Yes. So tell us a little bit about your path into becoming a physician associate and how did that all start?
Yes. So being from a rural area, I actually thought I was going to want to be a pediatrician. So I actually started on that track because for being in a rural area, you kind of only know about a doctor and a nurse. Those were the two main ones that I was exposed to. But when I went to Florida State University, that's when I really learned about the PA profession. And I have been drawn to it ever since.
That's amazing. I know. And that's so common. Even when I first started in college, I didn't hear about PAs and didn't know what it was all about. And that was, I guess now it's 20 years ago, but when college, but now it's amazing how many PAs there are, how many PA programs. I'm in Oklahoma, and when I applied to PA school, there was basically one program within the same university, just in two different cities.
Okay.
So, and now there's I think 5 or 6 different programs in Oklahoma alone.
So they've grown.
And it's really, and it's so competitive. I was recently interviewing potential PA students, and just the number of times they have had to interview and go through the process and try again. And it's remarkable just the tenacity of people who are now in the profession because they have fought hard to get there.
Yes.
Yes.
Most definitely.
Yeah. But what first drew you to developmental and behavioral pediatrics in particular? Because you said pediatrician, pediatrics, but what about that specific specialty?
I would say I wouldn't be doing justice if I didn't talk about a little bit of my background in it. So I did family and child sciences within Florida State. And when that was my major. So from there, I did a practicum where I worked in a PPEC, so prescribed extended pediatric care facility. And so at that time, I didn't quite know that I wanted to do developmental behavioral pediatrics, but I worked as a CNA there, saw children and took care of them from different things of G tubes, having needing medically complex care at that time, had a lot of genetic disorders, different things going on, blind, deaf, and I loved it. I love spending time with those kids as far as the joy that they brought to me. It was something that they taught me that a textbook could never teach me at that point. So I would say that experience is really what began to shape me and what I wanted to do, but I just didn't know about it at that time because I didn't know about developmental behavioral pediatrics until I was actually going through working in a school at that time, a Title I school as a pediatric provider. And I started noticing different things going on as far as behaviors, development. And I said, there must be something more. And that's when I did the research and actually got into a program for that specific specialty.
Okay. So you had that background of understanding the needs and the population. You had already been exposed to the specialty, and then you really digged deep into wanting to be more qualified and more educated and knowledgeable in it. So you found a program that taught you how to was it like an extra certification, or what was that all like?
So yes, so it's a fellowship program. It's a scholarship program for APPs, so advanced practice providers. And it's partnered with the University of Chicago for their specific DBP program for their pediatricians, where they train them and they actually do their fellowship. So it's partnered with them, and it's under Almost Home Kids. And so we learn for a year, just like a PA fellowship would be. So we learn for a year with them, doing clinicals, everything alongside with that. And I would say the program was phenomenal. I got to train by some phenomenal physicians and other healthcare providers and professionals from there. But that's where I got all my certifications from, even something as being able to do a ADOS for autism evaluations.
Okay, that's amazing. And so that's something also interesting for, people out there who are curious about how to better educate themselves and become knowledgeable and find out how to practice in this field. University of Chicago offers a program that they can look into. Okay, so that's pretty interesting because those types of things we don't really get to hear about unless, we hear
someone
about it on a platform and speaks on it. Yeah, exactly. And because it was your desire to learn more about it that took you to look into it too.
Yes.
Otherwise, I don't think we technically really learn about all the different programs and all the different fellowships out there in PA school.
No, we don't.
Yeah. But so you built your own practice and did that because, you could have just used that education knowledge and worked with an existing practice or within a system, health system, hospital system, clinic system. But what inspired you to build your own practice? Was it a particular patient experience or what happened there?
So I know I mentioned quite a few times that I'm from a rural area. I know that it's kind of hammered in now, but that was honestly my background and what I would say the main driver is. So being in the area, I know my family was fortunate enough to take me and my sibling across a state for pediatric care when we were younger. And so we went to a whole other state for care versus being in a rural area. A lot of families were either going to emergency rooms for their care or not getting it at all, or having to drive hours just like me and my family. So at that point, when I was younger, I knew that's why I thought I wanted to be a pediatrician and serve the rural area in there. But of course, things change, and I love the PA profession, being able to collaborate. That was the biggest driver of why I was driven to the PA profession. But going into the path as far as my practice, once I finished my program, I thought about it. I actually thought about partnering with pediatric providers and going from there. But I noticed that there was just no one who practiced like I did in this area. And there especially was no one, the DBP specialist that I knew about that was in this area, the office had been closed down for years. So yes, so that's the thing. This area did not have any care. And when I look at it, if people are familiar with the whole Florida Panhandle, from Pensacola all the way to Jacksonville is when this care begins for DBP. So I am spanning or covering that whole area essentially as the main DBP provider.
My goodness. That's just shocking to hear that it's so, just so rare to find these providers, first of all. And not only that, but in a rural area, there's hardly any access to that care. And I think that's such a key important thing that we should touch on, because access to care is something that I think across the nation, even globally, that's the number one thing that we all struggle with in many, many different communities out there, is that access. And rural communities definitely are hit the most with that. What, in your perspective, why, being in a Florida Panhandle, people think of Florida, wow, it's a great holiday destination, but you're saying there's a lot of rural areas with very limited access to healthcare and providers. You're the only developmental practice provider specialist in that area. Why is that?
Well, I should also add this because there is one more. She's a pediatrician, DBP pediatrician, but she's limited to TRICARE families, so military families in there.
Okay.
So being on base, that takes out a lot of the community from there. And then what I understand from them is that she doesn't evaluate. So they're getting ongoing care, but not evaluations from there. So that's a whole another part of it. But my biggest thing is it's also based off the person. What do you want to do after you graduate from PA school? Some people, they love being from a rural area. Some people like being on the outskirts, like more, or in the city, just going from there. I know me, I like a balance. I don't like traffic. I don't like being stuck in traffic, but I also want to be close and around other facilities or entertainment, things to do, but I'm so drawn to the rural areas and those communities, the underserved, helping that. So that's why I span that area, but I partner with other what I call satellite offices, almost like partner offices. But it's up to the professional to stay. A lot of the times, like we talk about entertainment or different things to do, a lot of people don't stay for that. And rural healthcare is a whole nother aspect because of lack of resources. You have to be innovative, different things of that sort. And some people are not saying that we aren't prepared coming out of medical school, because I know my PA school actually was based for rural areas. So we actually learned that. But somebody that's, say, from New York or something of that sort, they may not be equipped with the same rural care knowledge that I have.
Yeah, that's true. There's the personal preference of where someone would like to practice medicine, just like in any other career, where they want to live based on environmental and family factors. But you know what? And then, of course, that ability to thrive with limited resources is a tough one. But what can we do better with, given that you have this experience, you've practiced for years in this environment, what can we do better for healthcare access in rural areas, and how can we improve on that?
One of my biggest things that I think about is I think COVID made us realize that we can offer a lot of virtual and telehealth care. And I utilize it in my practice. Just because I'm using a telehealth platform does not mean that they're going to get lack of care. Is it always good to have that in person and be able to touch and that physical connection? Yes, I do believe that. I don't believe that it should be taken away. And that's why, like I said, I partner with other offices too, to be able to do some of that in-person care, more of a hybrid method. But I really do believe that, especially some of the specialty work, being able to reach those rural communities, sometimes even just to educate, be able to teach people how to take care of themselves in their home, can go far versus just saying, oh, I don't want to be here in this rural area, tough love, or something of that sort. it's, like I said, even just being able to educate them, it's one thing.
Yeah, that's true. And, just thinking about that education, that underlying thing, I think that's the basis of your practice. And what
Mhm.
you really focus on is helping patients and parents understand what they're facing, what they're
Yes.
going through. And can you talk about a little bit of a typical day and how your practice is?
Yes, even a typical day is not typical for me. I can
Yeah.
say that. So, for example, like Thursdays or at least once a week, I have an evaluation day where it could look like us staying more at our home base, or we could travel to another city, go into one of the other partner locations to do evaluations. Sometimes we're able to do clinic afterwards, depending on how many evaluations we may have, and other times we don't. So it just depends on that part. And when we have to travel, I have a big old box that I travel with, a little table, a little chair, come equipped to be able to say, hey, we have nothing at this office. Typically, all the offices I go to have a table in some sort for us to use, but I want to make sure that I come with all of my equipment just in case in there. But then also, a lot of the time, I think people are surprised with how much administrative time I put forth to each patient and family. So that's what a typical day looks like. If I'm not
Mhm.
seeing a patient, I still set it up where I'm 9 to 5, essentially, where
Mhm.
during those hours, I'm either advocating for the patient, say, though I may not take direct insurance, we still like to offer super bills to families that ask for them. And so I want to make sure that they are able to get the full reimbursement and making sure that they coincide with the quality care that they deserve too. So I'm fighting on that end for them. Or reviewing records. I don't believe that they exist in a vacuum. They didn't just come to me and that's it. I like to collaborate with their specialists on their care team as well, including their pediatric providers for primary care. If they have other specialists on their team, that's something that's important to me for us to find whether it's a root cause of something going on or if it's a change in their care plan or something, I like to know.
Mhm. Yeah. What has entrepreneurship taught you about yourself that just practicing medicine never?
What has owning a practice taught me about it?
Mhm.
I would say the entrepreneurship of it is different, not something that I expected on this side. Like when I was talking about the administrative work,
Yeah.
yes, we think about in medicine, we have admin time. And I think that's something as within our profession, we try to fight for healthcare
Mhm.
professionals. But there's also other admin time that I have to put towards just owning the practice and building that up,
Mhm.
going from there. So I would say some good and the bad, I guess I could say. Like I know I'm a very organized person, but when I have a schedule and I have to do other tasks, I was
Mhm.
easily able to weave those in, stay organized, do time management. But now that
Mhm.
everything is just on me and it's in the open of when I can do it, that has been a
Mhm.
little challenging for myself. Medicine did not teach me that necessarily because I think us coming from, I think you can possibly resonate from this too. We've kind of been told how our schedule is going to be through PA school, through
Mhm.
college, through that part, especially
Yeah.
taking science courses and everything like that. So I would
Yeah.
say the entrepreneurship of it has
Mm.
made that part challenging. Managing, but
Right.
challenging.
Yeah. Yeah. It's a different ball game than just practicing within a system
Hmm.
set up for you. You're setting it up on your own. And
Yes.
therefore you have control over your schedule and things like that, but yet you have control that you need to keep up with.
Yes.
Yeah. And so going back to the education
Mhm.
factor that you're all about, because I think initially you said you also do a lot of little videos that help patients kind of understand. But many people aren't familiar with developmental behavioral pediatrics. And, what are some of the most common concerns parents bring to you, or things that you find are lacking in the understanding?
Yes. So with developmental behavioral pediatrics, I know I've seen it two different ways where people are, like you said, unfamiliar with the specialty in itself. And so this is where pediatric providers are trained in, like further trained to specifically recognize autism, ADHD, those neurodevelopmental disorders, sometimes with neuromuscular disorders as well, too,
Mhm.
but mainly focused on behavior, autism, ADHD, learning, medical complexity. And I would say the overlapping part with mental health comes into that as well. So
Mhm.
that's the part of where the baseline, I guess I would say. And so
Okay.
most of the time when parents come to me, majority of, I feel like I'm going through a trend right now. Majority of people are reaching out about ADHD evaluations.
Okay.
But most of the time when they reach out about ADHD evaluations, when we start doing my comprehensive evaluations, because most of them are thinking, oh, we're just going to go through this assessment for ADHD and then that'll be all. But like I said, they don't exist in a vacuum.
Mhm.
So I look at the full picture and I notice that we start peeling back layers, different things. I do a detailed parent interview. I interview with the child, everything of that, do an assessment, and I'm peeling back these layers. And so we find out that there's so much more going on. And I feel like a lot of their misconceptions come out about
Mhm.
this specialty. And the part that's a little disheartening to me is that sometimes they come from years
Yeah.
of being unheard from the parent, voicing their concerns or hearing misconceptions in their, like from healthcare professionals and different things from
Yeah.
there. So that's why the education piece is really big to me. Like, yes, the specialty can be unfamiliar, but I really try to put it out there and let people know that this is just at the forefront development. So every child is going to develop in some form or fashion. So that's the first key. Then behavioral, like we talked about with ADHD, autism, that part of it. If you're noticing some, as they say, odd behaviors or not typical behaviors of that sort, that's where it gets more of, okay, do I go to the pediatric primary care? Do
Mm.
I go more into DBP? Where do I go from there?
Yeah. Yeah, it's interesting because when you said that, sometimes they just get the wrong information or just don't have all the information. Sometimes I
Mm-hmm.
think it's also this comparison. We can't compare each child to
Yes,
each other. And that's also something that can be a hindrance for parents as well.
agree.
And although milestones are there for the developmental progress, sometimes it's more of like a
A
guide
guide,
and not
yes.
a judgment,
Mm-hmm.
because each child is going to develop a little differently than, I mean, even looking at siblings, right? Each
Yes.
sibling is not going to be exactly the same.
Mm-hmm.
And so sometimes we can be overly, worried sometimes or just, because you said you do these in-depth detail guidelines. And I think when we first talked, you even like said something so beautiful that you were able to find some other reasons that why the child would be exhibiting these types of ADHD type
Mm-hmm.
symptoms or, differences. But then you're kind of pulling back as to like, maybe there's something else that we can work on. And there's something other
Yes.
than ADHD that is the actual
Mm-hmm.
diagnosis, right?
Yes, absolutely.
And so, I mean, also parents kind of wonder, is this just a phase? What do you say to that? Because that's also a concern. Is it a phase or is it something to key into?
So no question should ever be, I guess, put back in a box where it's like, oh, I'm not sure. This could just be a phase. So I'm like, if a parent has a question from there, I'm like, reach out, ask. Go ahead, ask somebody as far as that. I do believe in early intervention. And early intervention does not necessarily mean that we must diagnose your child. Because I think sometimes too, that can be looked at as a doomsday. As you're going to put a label on my child, you're going to diagnose. And so that's why I say I go beyond the diagnosis in my care.
Mhm. Yeah.
And so I think that's where it comes into play, where just being able to be comfortable to ask those questions about typical development. And as you said, using things as a guideline. I know the CDC changed the developmental milestones as far as looking at different things. And I still use both the old and the new as a guideline to look at typical development for each child and looking at what's going on for them socially. What's like a child with a sibling who's always carrying them, they're probably not going to be more inclined to walk. Yes.
Yeah.
Doesn't mean that it's a phase at that point, right? It's a phase that they're going through, but they're not having the chance to develop those skills. So now I'm here to say, hey, how about we try this? How about we offer suggestions based off of what they're saying for their actual situation versus they're saying their child is behind because they're 18 months and not walking. So that's where I come in, and that's where I look at it to be able to determine, is this a phase, or is this typical development, or is this something more, developmental delay?
Yeah. And I did another episode a few episodes back with Anya. She's a special education teacher in Sri Lanka, and she works with a lot of neurodiversity children. And she specifically actually started with another group of ladies, a school for them. And she was saying that sometimes in Sri Lanka, just culturally, it's hard for the parents to even acknowledge that the children are having maybe some delays or differences. And as you said, it's not about the diagnosis, but it's early intervention. But how do we get parents, or do you see in your practice parents that have had that difficulty in just even acknowledging to bring their child in for that early intervention or discussion?
I think I see it more, I kind of lean in saying this, I see it more on social media more than in my practice, because for my practice specifically, I feel like families are reaching out to me because I'm almost their endpoint. Like they know something is wrong and they're like, I need someone to help me. You seem like you would listen. I've actually had families say that. So that's where I'm seeing it more. So they're not afraid to speak up to me. But I have, when I mentioned about the uncovering the layers, I have a patient in mind from recently that I saw, and being able to talk to them and hearing some of the things that I'm asking, they had dismissed those because previously they had been dismissed on those concerns.
Oh, interesting.
Yes. So that's the part where, for me, like I said, I'm more of an endpoint. So I'm uncovering those. So they see, I voice these concerns, but it was looked at as not important, that they'll grow out of it, like you mentioned, as far as that. But on social media, and that's why I am there as far as the education part of it, and why I partnered with Neo Sophia, the app, to offer the education to where parents can message us for free on there for educational guidance in there. And that's nationwide that we do that. But it's just because I think with our day and time, like I said, with social media, there's many different things out there. And sometimes I see people almost afraid of saying different things because of the judgment that gets put out there. Or if they do speak up, then all of us, we have those passions, those things that we are very passionate about. And so then it's like we're so focused on that one thing that sometimes people look at it as comparison, and then everybody's stuck on the one difference of it or something of that sort. So that's where I say I'm finding where, like you said, are people actually recognizing it? I don't know. I just see the things on social media where they're just, we have a battle and a barrier from there.
I see your point too. Just the passions that people get behind that may obstruct them from listening to people or healthcare providers, or even acknowledging and understanding that maybe there's something that can be done.
Yes.
Or needs to be done, or at least have a discussion. Yeah. Do you see parents who are afraid of receiving these diagnoses, and how do you deal with that?
Yes, I do. And even despite someone reaching out to me, and a lot of the times the main thing that I hear is them say, I don't want to speak about this in front of my child. I don't want them to know that they have a diagnosis of something of that sort. And so in there, I actually talk with the parents. I go through different things with them and educating. And then I also talk about how we can talk with the child in this sort. If they're at the developmental appropriate age to understand it, even if they're not and they're younger. I have a child now, 4. We're talking about identity and about just bringing that in so we can prepped to be able to identify with autism, but saying that you have different layers within your identity. I look at it as a burger analogy. That's what I say. You have your burger, you have all your toppings. All your different toppings represent something different about you. Your bun is this is me. This is my identity. Your bottom bun is still me. It's my identity. If you take out a topping of some sort, you're still you. So if you add in autism in there as a diagnosis as part of you, you're still you. It doesn't change who you are. That's my simple analogy in there. But when I talk about like with the kids and we do like different activities and that sort of it, but that's just something where, like I said, I mainly see in my practice where they're trying to figure out how to explain this to the child or that they don't want the child to know versus more of, I don't want a diagnosis. Once they get a diagnosis, I'm right there. I tell the parent, when I prep them before I actually go over the results. I say, well, no matter what this says, I will always love to start with strengths of a child, always starting there. And that was actually what I learned from many of the medical professionals I trained with. And I stick to that because every child has different strengths and unique abilities within themselves. So I always start there. Then being able to tell the parent that no matter what this next part is that I say, I'm here to support whichever way we go. So I think just having somebody there with them gives them that ease and peace of mind of, I can handle this diagnosis.
Yeah, that's true. And I love that you brought up identity and how that's huge, actually. I was speaking with Dr. Hannah Hamlin on the podcast many episodes ago, and he has type 1 diabetes, and she developed it maybe 12, 13, 14 years old or something. So she was saying how as a young kid, she had to, think of herself as not just Dr. Hannah, I'm a type 1 diabetic, but who am I as Hannah other than the diabetes, and it's a chronic illness, and these are things that will carry through their life, but how do they find who they are other than the disease process or the diagnoses? Or, even as older adults, sometimes, chronic illnesses, cancer, diabetes, heart disease, those are chronic. We live with them. How do we, find ourselves outside of these problems or the issues or, the differences that we have from each other? And so that's a huge thing. And I love that you're saying that a lot of providers, are, all in this together, talking about that with their patients, and especially for kids, because that is huge for children to know who they are. And you can add things in or take things out because life changes. You're going to change. Things are going to constantly grow. But I love that. That's beautiful and something so important that we have to remember about kids is not letting them focus on things being a problem about themselves, right? And that what are their strengths, their unique abilities that make them just so amazing.
Yes.
Yeah. I love that. That's so important. And how can parents become like better advocates for their children? Because that's going to be something. And what and how or where do they have to become advocates? Or where do you see them having to be advocates more so than others? Or
I harp on it that I love the collaborative approach. So I say to parents that you are just important to your child's healthcare team as any of us healthcare professionals. They're the main advocate. They're the ones that mainly see their child besides teachers during school time, possibly. But for the most part, they're the ones that are seeing their child develop through all stages of life as well. So I want them to be able to trust their instincts and ask questions.
Yeah.
That's the main thing. They don't have to know every answer. Trust themselves and be able to ask the question from there. Then building from there, I would say building the team as far as the caregiver team that they want and that they feel is best for their child in there
Yeah.
and keep learning. There's so many classes, like how if there's particularly like if they have a diagnosis, or for my particular situation, like I offer parent coaching within stuff too. So that's actually paid, and I'll be starting back my group classes in August as well. So it's geared towards family, parent, and child. So, and I keep those low one set fee. So then that way it covers the full family. So being able to join in different activities and learning based classes and workshops like that. Or there's a lot of free resources too. I offer those on my blog and stuff of that sort. With social media, and we talk about that as well, how some things are credible, some things aren't. Going back to trusting your instincts, if it feels off, don't trust it in that part
Yeah.
of it. But being able to go to reputable sites, and like I said, there's a lot of free resources out there too for families.
Yeah. Yeah. And how do we what are some simple things like families can do at home to support that healthy development?
I see your book back there. And
Yes.
one of the things I am really big on is reading to your child. Reading to your child, even it doesn't matter what stage, what age of development they are in, always being able to digest and process those auditory words and things of that sort is good for their development. So even being able to read aloud something that is appropriate, but may not even be on their developmental level, so they hear it, is still good. They actually say like being able to listen to the radio. That was one of the things that research and studies showed in there as far as the development with child being able to have a more vast vocabulary because of listening to those words. So that's one thing. Even if you have more of a visual learner, being able to read to them and show them the words as you're going through it. Maybe if they're more hands-on in there, letting them hold the book, turning pages, them following along for you as you're reading. So then that way, if they're going too fast, maybe like with their finger, you can stop, give it a pause, make sure they get back where you are at and go through it. So you're putting all the things together in there. And I know for right now, me and my kiddos, they are 12 and 10. And we're reading a chapter book together. And so that's what we do on our car rides now. They each read a chapter, going back and forth. We discuss it. And I don't read to them now, but they're reading aloud and practicing those skills during this time.
Yeah. Yeah. That's actually a huge thing, is that reading, increasing just their access to vocabulary and words, and understanding the comprehension of being able to put the words together, the sentences together, and then regurgitate it, or actually comprehend what's actually going on in the scenes. Yeah, there's so much that reading, and as you said, the books there. That's why I wrote the books, because I love to, help and advocate and empower kids too. And so I thought I'll do it in a simpler, fun way. But you're doing it in an amazing way with your practice.
So are you. Like we talked about unique abilities. We all can't do it all.
Yeah, exactly. And so, but speaking of going from reading to technology, how is technology changing developmental care?
Yes. So I know one aspect of there is just the telehealth, being able to offer that care, and still, even in the education part, doing virtual workshops, being able to spread that love all throughout. So that's one big thing. But then also, like I mentioned, I collaborate with Consult for an app, Neo Sophia Early Screener app. So that's one of where I say technology and now AI in that sense, being able to where they created an app where parents can actually go on there and do a autism screener. And then the results, like if they get a positive result or a high risk result is actually what I would say, is then it can be sent to me and they can discuss that with me. I can help navigate them through the next steps. So they're not, one, like I said, receiving that and being all alone. They actually have support right then and there for themselves and for their child, because sometimes even getting into their healthcare provider can take time. So that's one thing. And sometimes parents are, like we talked about, that comfortability, being able to be at home and say, oh, let me do this screener in the comfort of my home, because some parents aren't as comfortable asking the questions sometimes, like we mentioned. So that's a way to get connected with a specialist and be with a credible source in there too, but still be comfortable in doing it behind a screen. So that's some things that I see that technology and AI could expand and change how it's practiced as far as DBP.
Okay. What about like the role of AI? Specifically, I know these apps, they probably have some adaptive, AI incorporated, and agentic AI just in healthcare is a big thing. Do you have any new information that you're seeing that is coming into this field of medicine, particularly in the neurodiversity development disorders and helping kids and their treatment plans or protocols or things like that?
I know particularly there's a study, I can't think of it. I listened to a podcast on it one morning while I was driving, and one of the things was talking about like cochlear implants and things like that, but they were actually talking about those that have a gene that affect their hearing ability, that part of it. And so they were talking about the use of AI for that. And particularly with this new device that they were saying something about with AI to be able to process that for them. So that was one of the things that I looked at that I know, I was like, that could be interesting. But then it also got into, okay, are you modifying genes and things of that? So it kind of got deeper into it and away from the AI portion for the device to me. But that was one of the things that I saw. As far as, like I said, right now I'm seeing more of AI with note taking for versus actually AI and other tech fields or technology for the DBP care and disorders.
Okay. And, you also mentioned how technology can empower parents without replacing clinical judgment because of those initial screening tools that they can kind of grasp at home, do on their own, and then kind of get preliminary results and information so that they're a little bit more prepared when they come to the office or the visit and be able to remember and ask the right questions, maybe since they've already been exposed to a little bit about what to expect. And so that's, the good thing about technology and
the good
that
part.
there is. But, do you think that there is anything that's detrimental for kids' development that you see as a provider? What are things that we as parents can look out for with technology that may hinder our kids' growth and learning?
Yes. So with technology in there, I think it's a fine balance where, like with the AAP, the American Academy of Pediatrics, I was about to say AAPA, but their recommendations on screen time for children and that part, especially if it's not a learning-based activity. But what I've seen a lot is, and I really think that there's going to be a lot more research done on it, is the tech-induced part of ADHD and other behaviors that come in it. And there has been research thus far, and especially in the education systems, there's already research going on and considering adding in other, like going back to some of the basics as far as school systems and school curriculum, just because of what some of those trends that they're noticing now from adding in technology. So that's the main thing that I see, where a basic pencil and paper is always good. Given that imagination and creativity is good, it's okay for a child to be bored. Is okay. That's when their imagination and that neuroplasticity making those new connections happen. Give them a box. Let them draw. Let them get creative. If they're not one of those and you want to see they're more active, give them something like allow them to make an obstacle course and do different things with that. Giving them time to be bored and creative versus consistently getting the dopamine that some of those TV shows give. Those fast-paced, ever-changing colors and different things of that sort can, like we talked about, be, I won't say detrimental, but can definitely hinder that development or change it. Neuroplasticity can be used in a good way or in a bad way. We can make different neural connections based off of just consistency. So if you're consistently getting dopamine based off of TV shows and that excitement factor, or something as simple as, I know my children, I let them play newer games and older games. And the reason for the older games mainly is because the newer games, they're infinite amount of lives. they don't die in those games. And I hate using that word, but they don't.
Yeah.
They're infinite amount of lives versus, so now it's like they don't know how to cope with in game in there is what I'm finding for a lot of children. So even just thinking about something of that sort for parents, knowing that, hey, if they're not getting it from some of the other things that we may have gotten in the 90s, 2000s, 80s in that sense, we may have to make them in the house, like change the way that we do different things or teach them those coping skills because they're not getting it from other things.
Yeah. Yeah. And it's true, like, because I was listening to an NPR episode on school systems, and they were talking about how, they're using computers in schools for, everything. They basically don't have books or anything nowadays. I have a 6-year-old, so I still don't have, and I went to, public school many, many years ago. So the newest ones, I don't have kids in the new schools. But so they were saying everything's on computers, everything's, they don't have books. They don't use a pencil and a pen anymore, paper. And so, but they were saying that they provided computers to everybody to provide equal access, equal opportunity based on, on maybe skills learning or even socioeconomic differences. But they're finding that actually it's not making a difference. And in fact, maybe decreasing the test scores overall than any improvement in them. And so many schools are actually taking away computers and going back to pen and paper, which makes so much more sense because if you talk to any neurologist or neuroscientist, they'll always say that writing helps you learn that actual physical movement and, using your 5 senses helps you learn because they were even saying like on that NPR episode, like how when you're reading on a book, your eyes will go like, left to right. We're going to be reading every line, every sentence. But when you're on a computer screen reading, sometimes you're just going top to bottom because you're scanning versus actually reading each and every word too, which impedes our ability to understand and cope with every vocabulary word that, as we stated earlier, reading is, helping us with, right? So it's really interesting, the pros and cons with technology. In the end, we have to learn that, realize, I guess, even with AI, even with technology, it's that human input. And that human input is good, but it can also be flawed. And so we have to be aware of both. But going back to like how you work with parents, and with these different kind of sometimes heavy diagnoses and things that you have to discuss with patients and parents, how do you help parents move from fear to hope?
Fear to hope. I think the biggest thing, like mentioning the strength of the child and then just letting them know that I'm always here in that support. And they can always contact us. They can always follow back up with us in that sense of it. Parents like to know, like I say, we go beyond the diagnosis. Parents like to know that this is not the end game. I'm not on my own at this point. Because like I said, a lot of the things that I was seeing is they have the diagnosis, but they're unfamiliar with any resources out there. They don't know where to go from there. A lot of the times people think, oh, you have the diagnosis, now you know, and you should be happy. But sometimes it was, I have the diagnosis and now it's creating more, like you said, fear or the worry in there. And the question that I ask in my practice is, what are you concerned about for their future? And I ask about that. I want to know that. And that's something that I want to see. Okay, can I help, like you said, in that hope part, help them in there, help them, whether it's helping the parent be able to understand what's going on and not saying that this is something forever, that there could be changes, whether it's making them feel comfortable with the diagnosis and with the next steps and how the future can go. Like I said, just different supports and being there within our clinic, whether they're on the clinic side or the education side of it, just being there to support along the way is the biggest key.
That support is so important. It goes back to the community that we need around us. And I love it that you're the clinician, but you're saying, I am part of your community and I want to be part of your
Yes.
community to bring that hope and help and healing. Right. And so I think that's the beauty of what you do, the beauty of what we can do as clinicians is be a part of that community for our patients and communities we serve.
Yes.
Yeah. And when do you think, or when you think about the next 10 years of developmental pediatrics, what gives you the most hope?
For myself, what gives me the most hope is I think we talked about technology and everything of that sort. So the innovations, and I know for myself, being here in rural-based area and some of the innovative things that I had to come up with to get creative and get the care that a patient may have needed in there, I actually see that we have tools now that can reach those rural areas, that can bring those resources to those rural areas, and also the platforms of social media, being able to expose it and bring light to it. It makes people say, oh, okay, now almost like we're coming into that community where it's a city maybe partner with a rural area in that sense of it now. So looking at it in the sense of community because of the technology that we have. But then also I see a lot of things like far as genes, being able to study those. Like I know the AAP now recommends that we get whole exome testing done for people with intellectual disability or global developmental disability in there. So I'm like, okay, this is different. I've been doing this since I was practicing, but now to see that now this is actually recommended, I was like, okay, we're progressing. This is something that, and they're actually wanting pediatric providers, the primary care providers to do this. So that excites me because I'm collaborative. I don't look at it as competition. Like anything that we can be doing that benefits the child, benefits this family, like that's what I want. So the more knowledge and education that's growing is what I'm most excited and hopeful about, that 10 years from now, maybe we really will be talking about early intervention within those primary care fields where it's not necessarily that the DBP field won't be needed, but now we're all really connected and actually know the baseline of this to get that early intervention for those families.
Yeah. Yeah, that's amazing for that, it's not about the competition, it's about collaborative work together for the best of the patient, the community, and hopefully, yeah, we'll see some better approaches and protocols that will relieve the burdens on singular entities and bring that team-based approach to have better effective care, right?
Yes.
Yeah. Yeah. So last question, as a woman leading a specialty practice, what leadership lessons have shaped you?
What leadership lessons have shaped me? I would say this came before entrepreneurship. And this would be something like I love teaching in there. That comes from the education portion with parents, but then also being able to train the next generation of healthcare providers. Love doing that. I've been a PA preceptor in there. So that's and mentor for many years. So that's something far as leadership that I say I bring now too. And so though I love teaching and training the healthcare professionals, I look at that as, okay, I'm training these parents as well because I can't be with them 100% of the time. I can be there to support, but I can't be with them 100% of the time. And so that's something where I think is a transferable skill for not just if you're an entrepreneur, but like I said, I see it more now that I'm an entrepreneur. I see more of those opportunities to teach and educate, but I think it's transferable throughout no matter where you're at practicing, to where you can look at this as education. What knowledge can you share with whoever's in front of you, whether it's a student, a parent, a family member, the patient themselves? Being able to educate and share your knowledge, that's what you're doing as a clinician.
Yeah, so true. And so thank you so much, Christina, for spending the time on the
Of
podcast
course.
and sharing your journey, your insight, and your mission and your heart. I really appreciate it. And so thank you again. I appreciate your
course.
time.
Thank you once again for having me. And I love what you're doing.
Thank you so much. I'm so grateful, and grateful for clinicians like you guys too, who are sharing what you're doing. Today's conversation reminds us that every child deserves to be seen for who they are, not just measured against milestones. Early support, compassionate care, and collaborative partnerships can make an incredible difference for children and their families. A huge thank you to Christina Davis for sharing her expertise, her entrepreneurial journey, and her heart for serving neurodiverse children and families who love them. If today's episode encouraged you, be sure to subscribe to Medicine Motherhood Missions. Leave a review and share this episode with a parent, healthcare provider, educator, or friend who could benefit from this conversation. Remember, whether you're practicing medicine, raising a family, or pursuing the purpose God has placed on your life, your work matters. Keep showing up with compassion, courage, hope. Until next time, keep living with purpose and continue to spark hope wherever you go. Thank you. Thank you for joining us in this episode of Medicine, Motherhood, and Missions. We hope you found inspiration, insight, and a sense of connection in the stories we shared today. If you enjoyed today's episode, be sure to subscribe and leave us a review. Your feedback helps us reach more listeners like you. Follow us on Instagram for updates, free downloads, and join a community of like-minded individuals passionate about making a difference through medicine, motherhood, and mission work. Remember, you're not alone in this journey. Until next time, keep sparking hope, keep healing, keep nurturing, and keep making a difference. This is Johanna signing off from Medicine, Motherhood, and Missions. The medical opinions expressed on this podcast are for informational purposes only and should not be considered as medical advice. Always consult a licensed healthcare provider for personal medical concerns or questions. The views expressed by guests are their own and do not necessarily reflect those of the podcast host.